Volume loss. In this session, we are going to learn how we can identify volume loss in chest X-ray. It is a very essential and useful skill in the interpretation of chest radiography. As soon as you see the X-ray, make sure that you compare the volumes of the right side and the left side. Normally, the right lung volume is slightly larger than the left lung because a part of the left hemithorax is taken up by the heart. One additional thing I want you to know is that right diaphragm is slightly elevated compared to the left diaphragm. That is a normal finding. Now look at this X-ray. Look at it from a very gross perspective. See the volume of the right lung and volume of the left lung. You can just see that this left lung volume is comparatively smaller than the right lung. Here is another X-ray where you compare the right lung and the left lung. So the right lung is smaller compared to the left lung. Disregard other findings as of now, just see the focus on the volume. The right lung volume is pretty smaller compared to the left lung. So this is a very important thing. As soon as you see the X-ray, you have to just look at the gross volumes of the right and the left lung, and if there is any significant reduction in the lung volume, you should make a note of it. Now let's come to the potential causes of volume loss. The volume loss in chest X-ray could be due to fibrosis, collapse, lobectomy, pneumonectomy, parenchymal destruction due to any cause, or congenital abnormalities like pulmonary hypoplasia or agenesis. The key findings in unilateral volume loss includes ipsilateral tracheal shift, ipsilateral mediastinal shift, elevated hemidiaphragm, narrowed rib spaces, contralateral hyperinflation, herniation of the contralateral lung, concavity of the spine. We will see each of these findings in X-rays. This is the first X-ray of this session, and it is also the most important X-ray in this session. I want you to focus on this X-ray because every finding that we discussed in the previous slide is present in this X-ray. So first of all, look this X-ray from a gross perspective. Now this is the right lung. It's quite obvious. It appears very large. And if you search for the left lung, it's nearly absent. We find some shadows here, but yeah, so it's nearly absent. It's kind of white out, and some air pockets are seen here. So from the gross perspective, we can say that the right lung is much larger, and possibly the left lung volume is reduced. Now let's look at the other features. Now focus on the trachea. So here is the trachea. So this is the trachea. So the trachea is shifted to the left side. That is the ipsilateral shift of trachea. Now search for the cardiac shadow. So normally the cardiac shadow crosses the midline, and the right heart border is around this point. Around the right heart border is found here, but you don't see those things, and you don't even the spine. You don't see that any shadows of similar to cardiac shadow. So obviously this cardiac shadow is shifted up here. It is shifted up here. and so we don't see anything here, so it is shifted to the left side. So there is also a ipsilateral mediastinal shift, because the cardiac shadow is a representative of the mediastinal shift. So cardiac shadow is shifted to the left. Now see the diaphragm. This is the right diaphragm up here, and here is the left diaphragm. I have told you in the previous slide that the left diaphragm is slightly lower than the right diaphragm. So, but here you see that the left diaphragm is elevated. So there is an ipsilateral elevation of the left diaphragm. Now look at the rib spaces. So this is the rib space on the right side, and corresponding rib space is this. So we have to compare only the corresponding rib spaces. So this space is larger than this space. So here it appears larger than this one. So the rib spaces on the left side are narrowed. The next point is, if you see this lung on the right side, there is what you call as a compensatory hyperinflation. It is enlarged because of the loss of volume in the left side. So to compensate for the right lung has enlarged. So this is a compensatory hyperinflation. Now we have another thing. You see a black shadow up here, right? So this is basically, it's not the left lung, this is the right lung becoming so large and herniating into the left side. That is herniation of the right lung into the left. So this is also a feature of volume loss, on the unilateral volume loss on the left side. So right lung becomes bigger and then it herniates into to occupy the left lung space. This is the herniation. So if you see the spine, if you can see that these spines are darker here. So it indicates that lung has crossed the midline, right? So here you see the spine is a little bit wide, but if you see here, it is darker, right? So it means that this lung is crossing the midline. Normally you don't find this kind of darkness here. So it indicates that it is crossing the midline and it's coming up here. So that's called the herniation of the lung. Finally, you see the spine. So this spine is here, right? So if you see, there'll be a subtle concavity to the spine. So this end is closer here, and this sort of a concavity, C-shaped sort of thing, and this concavity is towards the lung in which there is a volume loss, towards the hemithorax in which the volume loss is there. So because the both ends are likely like pulled, something like that. So the basic, that is a philosophical principle that nature abhors void. That is, nature hates empty spaces. So whenever there is an empty space, the nature tries to occupy that. You will find that if there is an abandoned house, then you can find that fungus grows there, plants grows there, nothing is empty. Nature doesn't leave anything empty. And similarly here you have this left hemithorax where this lung is abnormally has a reduction in volume or almost destroyed. So everything around this left hemithorax is trying to enter into that. So we found that the trachea is entering into this thing. There is a shift. We found that the opposite lung is herniating into this space, and this diaphragm is kind of elevated and it is moving into the space. The rib spaces are narrowed. So almost everything around this particular hemithorax, which has a volume reduction, is trying to enter into it. So these are the secondary features of volume loss. So I repeat, so first see this X-ray grossly, then you can find that the right lung is larger, and then you find that the left lung is almost absent. Then all the features of volume loss is there. Tracheal shift is there. then mediastinal shift, that the heart shadow is shifted to this thing, the diaphragm is shifted up, the rib spaces are narrowed, and the opposite lung is hyperinflated, and it also herniates into the left lung. So this is the X-ray for studying volume loss in chest X-ray. Now let's move on to other X-rays, and I'll be pretty fast. Basically, I want to convey, I want to make your visual memory very good by seeing multiple X-rays. So we'll tell about the key features and then move on to the next X-rays. Okay. So here, just first see grossly. So grossly you can see that the right lung volume is much smaller compared to the left lung. Right, so right lung is smaller, left lung, there's fibrosis up here and all, but we'll ignore all these things, but we'll see the focus on the volume. So volume is less, here volume is quite large. So you can see that usually the cardiac shadow should be in the left side up here, right? In this area should be occupied by the cardiac shadow. It is not there, so it has gone shifted to this thing. So there is a mediastinal shift to the right side, and this is the trachea, right? So trachea is also shifted to the right side, so there is a right-sided volume loss. So next X-ray, you can see that this is the right lung. Up here left lung is absent, the ribs are quite abnormal, so this is right and this is left, right? So the left lung is absent, so obviously the volume loss is on the left side. I think this is pretty clear. So here you have the right lung quite large, left lung is absent. You can see that this right lung is coming up till this space, right? Normally when there is a cardiac shadow, this cardiac shadow is slightly crosses the midline to the right, and this right heart border is present up here, but here this lung is fully occupying this space. It itself indicates that the lung is hyperinflated and it's kind of moving towards the center, and this cardiac shadow has moved to this place, potentially this cardiac shadow. Then this is a complete whiteout here in the left hemithorax, complete whiteout. You see this diaphragm is elevated. So see the diaphragm in the right side, see the diaphragm in the left side. This diaphragm is elevated. This is the fundal gas shadow or the gastric shadows or maybe intestinal shadows, but this is from the abdomen, right? So this diaphragm is elevated, and then you see this the trachea is on the left side, and then it is divides into, this is the right main bronchus, and then there is the left main bronchus, and then you see that the end of the stump of the left main bronchus. Just see the shadows coming up and dividing into two, and then here it is abruptly ends. I'll tell you the diagnosis. This is a case of pneumonectomy. So they had removed the entire lung. So when you remove the entire lung, the space becomes narrow or reduced in volume. And usually in post-pneumonectomy, a fluid actually fills up this space. So as I said in the last slide, nature doesn't like empty spaces. So once you remove the lung, CS fluid fills this space, and it kind of fills up. But the unilateral lung volume is reduced. But you can say that by seeing that the diaphragm is elevated, the cardiac shadow is shifted to this ipsilateral side, trachea is also shifted to the ipsilateral side. So remember this is a post-pneumonectomy X-ray. Here again, grossly, this is the right lung and this is the left lung. You can see that the right lung is smaller compared to the left lung, grossly. Now, if you see this trachea, it is shifted to the right side. Here the diaphragm is elevated. And you see the left lung, so it's kind of larger. This cardiac shadow is shifted to this side, because normally cardiac shadow is up here, but it's not very visible. So it's shifted to the opposite side. So shifted to the same side. This is the area where there is a volume loss, shifted to the same side. This is a cavity, right? So there's no bronchovascular markings, and it's look up here is large without any avascular structure. So there's no bronchovascular markings. So this is a air-filled space surrounding this thing. It's a large cavity. And here you have some cystic spaces and fibrosis up down here. So it's kind of a, lung that has had some insult in the past, maybe tuberculosis or something like that. But you can see that the trachea is shifted here. So we say that the mediastinum is shifted, the volume is reduced, there is a cavity up here, and this lung seems to be larger, right? Larger comparatively. So there is a volume loss on the right side. You have to remember some cavities are so large. So this is very important when you put ICDs. You have to ensure that when you see something like this, you have to make a differentiate between a cavity or is it a pneumothorax sort of thing. Here it is a cavity. This X-ray, just see grossly left side there is a volume loss. If you see compare the spaces, this right rib space, compare it with the left. The left it is narrowed. It's very quite obvious, and the diaphragm is also slightly pulled up, and there is a diffuse thickening sort of thing here. It is a pleural fibrosis or pleural thickening sort of thing. Because of that, this area is contracted, so the hemithorax is also contracted. So main thing here is to look the rib spaces. It's very obvious. See the rib space quite larger compared to this side. It's quite narrow here. Again, so this left lung is larger, the right lung is smaller. Here is fibrosis. So it's a fibrosis, one of the causes of volume loss. And you can see this diaphragm. It's tenting of this diaphragm. This is the juxtaphrenic peak sign. So it is tented, and because the pull of the fibrosis, it's going up. So you see the trachea is up here, and this cardiac shadow is supposed to be here because it should be in the left side. It does move to the central area and towards the right. So there is a right-sided volume loss. This X-ray, see the right side, it's almost destroyed. Left lung is larger. This is the trachea is shifted to this thing. This is the diaphragm end. It's coming up. So there's a right side volume loss. I'm going to be fast because it's already a bit of a lot of time we have spent in this session. So here the right lung is large, left lung is destroyed, some cystic spaces are there, and here you have the trachea shifted to the side, so diaphragm is elevated, kind of herniation of the lung is also seen. Volume reduction on the right side, so fibrosis, this is a large cavity, see the avascular space, this lung is larger, big, and this cardiac shadow is up here, right? Is supposed to be somewhere here, so it's shifted to this opposite side. So this indicates the right side lung volume loss. You can also see the trachea getting shifted to the right. Trachea is shifted this side. This gross volume loss is there. This right lung is larger. There's a diffuse opacity, and here, so kind of pleural thickening, and this is a calcified, patchy calcification is seen here, and you see this is up slightly, up reduction in volume. So this is also a sort of a pleural mass or a pleural thickening. So this lung is larger, and here you have a smaller, so left lung volume loss is there. So trachea is somewhere, I think here it's also shifted, and diaphragm is also up here. This is a case of left lower lobe collapse. So because of the collapse, there's volume reduction here, and this lung is enlarged. As I said previously, this cardiac shadow should come somewhere here, but you see this, the lung is fully up here, and even if you see the spinal area, you can see the darkness behind, meaning that the lung has come here. So again, it is a volume loss on the left side. So conclusion, so as soon as you see the x-ray, one of the most important thing is that you have to check the volumes on the both sides, right side and the left side, and compare uh, each other. If there is gross volume loss, then you have to go think about what could be the potential cause of this volume loss. So cumulative learning. So in the first session, I advise you always look for the CP angle in every X-ray that you see. And here I am saying you that you have to identify volume loss, if any, in the X-ray. Thank you.